Well, as the country observes Mental Health Awareness Month, the stigma associated with mental illness remains a concern for patients. Those living with mental disorders say it was hard to accept their diagnosis because of how it is perceived in society. A 2021 UNICEF South Africa study revealed that at least 65% of young people with mental-related issues did not seek help, and some of their reasons are the fear of what people would think of them. To take this discussion further, then, we are now joined via Zoom by UNICEF South Africa representative Christine Mohigana. Very good afternoon to you, Christine. Thanks so very much for joining us here on SABC News, ma'am.
Good afternoon, Flo. It's a pleasure to be with you, and thank you for the opportunity to speak to this very important topic.
You're welcome. I mean, a very concerning report there that was, or study that was released by UNICEF revealing that at least 65% of young people have mental related issues and they did not seek help. I mean, mental health has become quite a big topic here in South Africa. Let's talk about this particular study and what it really pointed out, especially given the fact that, we're talking about mental health on the back of matriculants about to write their final examinations from tomorrow. It's important to kind of iron out these particular issues.
Absolutely. So this U report poll, which is actually young people speaking up on the issues that concern them, tells us, as you just recall, that 65% of them have mental health issues and do not necessarily seek help. And when we look at the reasons why young people have anxiety issues of ill mental health, the need or the relationship to them wanting to succeed in education is one of the lead reasons why there is anxiety. So it's very important, and I'm happy to hear and see from the report that you just aired before this particular segment that the basic education minister is speaking to young people, telling them that measures will be put in place. Measures will be taken so that matric exams can take place, and things are done so that if there is anxiety around exams, it's not exacerbated by this power issue.
Yeah. Over the years, mental health has been, very stigmatized, which has caused a lot of people to hold back and not to talk about it and to look for help that they obviously need. But it seems that, now that there is a spotlight on mental health, that people are talking about it more. Has this in any way changed, from the time that, you were doing this report? Because it does seem as though there is a turn of tide.
Absolutely. So if there is, for example, one positive thing that we can observe from the COVID-19 pandemic is that the pandemic and the issues around it affected so many people that it's easier or it seems easier to speak about mental health or mental related issues. And so from last year, when we started conducting this poll in young people around their mental health, it looks as if there is more knowledge about what mental health is, and the stigma around it seems to be lessening, which is a very positive trend. So young people speak about it. They're telling us whether they sought help, when they were confronted with anxiety, with issues, and if not, we also know why. For example, they didn't know where to seek help, or they thought that it was not serious enough for them to seek help. So this is something that helps us then make sure that there is information, knowledge out there about what mental health is. There shouldn't be any shame or stigma around it, and here is where you can seek help.
Yeah, and in fact, while you're talking about, the fact that young people had said that they didn't know it was serious enough, and the fact that they didn't know where to seek help. I think that's actually important to address that. In fact, it seems you anticipated my next question, because I was going to ask, where do they start when it comes to seeking help? I mean, not all of them have necessarily those support structures coming from either their parents or their guardians, and some support structures require one to pay, which some young people simply don't have. So where do young people actually then start when they are seeking help and do acknowledge that they need help?
So one important thing to underline is that the earlier there is awareness about anxiety or mental health issue, the better. So sometimes it's as simple, the response could be as simple as reaching out to someone and talking to even a peer. And what the poll that we just conducted, the new results show that young people actually were able to help each other when confronted with anxiety, with mental disorders, and some of them actually have the knowledge to refer their peers, their friends, family members to either another person whom they know can help, or to mental health or clinical special service when they exist in the community. There's also, and this is something that UNICEF in South Africa supports, possibility that a teacher, somebody who works in the school system, is someone that you can reach out to, go to, and get help with. This is something that comes on top, of the responsibilities that teachers currently have, or educators currently have. But we do support the Ministry of Education, the Department of Basic Education, to provide such additional skills, specialized skills, so that they can detect when a child in school shows signs of distress and needs support, and children then know also that this is a resource that they can avail themselves to. This is also something that we want to see more in the health system. Getting people who work in health centers to have that additional skill to help young people, adolescents early on, so that it doesn't develop into something serious, and then if there is something serious, they know where to refer them to.
All right. And of course, we understand, we've been focusing on the 2021 study that you did, but we understand that you will be releasing a new report on mental health awareness tomorrow. Are you able to perhaps take us through, some of the, the findings, or what are some of the highlights that you can share with us in South Africa on areas that your report did in fact focus on?
Absolutely. So one positive trend that we see from last year is that more young people who know that they or feel that they have signs of distress, anxiety, have actually sought help. Another positive trend is that more of them feel that they improved, their mental health improved over what it was before, even though we still have a good proportion, like a quarter of the young people who responded saying that they feel that their mental health worsened over the previous period. And around the 20% or so say that they wouldn't be able to say whether there is a change or not. I think something very important and positive about the new results of the poll is that there is more knowledge out there, which also helps the community at large to respond to this need. And as I said earlier, this also is something that something positive that comes out of the impact of the pandemic is that, there's more information out there, less stigma, and therefore more attention, whether from the public or from the private sector or academia around this issue that helps us, be more responsive to the issues that young people or children face in this area.
All right, Christine, thanks very much for weighing in. We certainly do appreciate your time and input here on SABC News.